what are all the benefit I can get from Vaso-Meditech EECP treatment? So when you want to look at the benefit of EECP treatment, there are two aspects. One is what the patient wants to achieve, which we call as a subjective, and one is what your cardiologist want to see in your diagnostic report, which is called objective. Subjectively, after undergoing 35 days of EECP treatment, the patient who are not able to walk for a couple of minutes can able to walk more than 40 to 45 minutes without having any angina, without having any shortness of breath. And usually before EECP treatment, most of the patient would have tiredness, easy fatigability. So, but after the 35 days of EECP treatment, the patient feel fresh and they have more confidence to walk and take part in the daily activity. Number 3, nitrate intake. Many times the patient before EECP will be taking sublingual nitrate to relieve the chest pain. Many of them are taking 20 to 25 nitrates per week to relieve the chest pain. But after taking 35 days of EECP treatment, this patient may not require this medication to keep their angina or a chest pain away. They may be able to walk more distance without taking any of this nitrate. And also many of the drugs, for example, the patient, if they are on a hypertensive drug, EECP tends to lower the blood pressure, so their hypertensive drug can be tapered down. And many patients with diabetes who have poor glycemic control or the blood sugar is so much fluctuating, usually after the 35 days of EECP treatment, the blood pressure control is much better than before. And the lipid, and third important thing is the lipid. The cholesterol level has also shown to drop after 35 days of EECP treatment. So these are all the quality of life which the patient want to achieve, which can achieve by 35 days of EECP treatment. And second is what your physician or cardiologist want to see. So if you have taken a treadmill, which is we call walk on a treadmill, and then assess when there is a ECG changes. Before EECP treatment, let's say if you have a 3 minutes or 5 minutes exercise time and they would have a changes in a EKG, then now after 35 days of EECP treatment, if you are again going on a treadmill, you are able to walk more distance than before without any change on the EKG. Number 2, if your physician, and many patients also request us, I want to know how my blood flow has improved, can I have any diagnostic procedure can be done to see whether my blood flow has increased across the blocked artery. The best test to perform is we call as a myocardial perfusion scanning. So if your cardiologist order this myocardial perfusion scanning before and after EECP treatment, you can see a significant improvement of blood flow beyond the blocked artery, which can be assessed by this perfusion scanning. And third is a simple echocardiography. Before EECP, if you have a low heart function or poor heart function, or your muscle is not moving adequately, then after 35 days of EECP treatment, there is a 15 to 20% increase in the heart muscle contraction. So your heart overall pumping function can be improved. And also after 35 days of EECP treatment, many neurohormone or chemicals which is good to your body are released into your circulation, because your body thinks you are doing some kind of an aggressive exercise. To support the exercise, lot of neurohormone and chemicals are released in your blood circulation, and this significantly improve your collateral formation and improve your overall vascular function. So all these things can be assessed by some diagnostic test which can be recommended by your cardiologist. So these are all the overall benefit what the patient can expect from undergoing a 35 days of EECP treatment.